What we did very early on was say 2/3 of the costs of health care reform, which includes providing coverage for people who don't have it, making it more affordable for folks who do, and making sure that we're, over the long term, creating the kinds of systems where prevention and wellness and information technologies make the system more efficient, that the entire cost of that has to be paid for and it's got to be deficit neutral. And we identified 2/3 of those costs to be paid for by tax dollars that are already being spent right now. So taxpayers are already putting this money into the kitty. The problem is they're not getting a good deal for the money they're spending. That takes care of about 2/3 of the costs. The remaining 1/3 is what the argument has been about of late. What I've said is that there may be a number of different ways to raise money. I put forward what I thought was the best proposal, which was to limit the deductions, the itemized deductions, for the wealthiest Americans. People like myself could take the same percentage deduction that middle-class families do, and that would raise sufficient funds for that final 1/3. Now, so far, we haven't seen any of the bills adopt that. There are other ideas that are out there. I continue to think my idea is the best one, but I'm not foreclosing some of these other ideas as the committees are working them through. The one commitment that I've been clear about is I don't want that final 1/3 of the cost of health care to be completely shouldered on the backs of middle-class families who are already struggling in a difficult economy. And so if I see a proposal that is primarily funded through taxing middle-class families, I'm going to be opposed to that because I think there are better ideas to do it.